Hello, I'm Dr. Ken Lessons from Keystone Urology. In a moment, you're going to see some presentations from our partner practice, Mid-Atlantic Urology. If you're looking for answers, insights, or expert advice, please sit back and enjoy the presentations. You've come to the right place.
I'm Dr. Kara O'Brien, and I'm very excited to discuss a topic tonight that is near and dear to my heart, and that is vasectomies. This is part of our men's wellness webinar series. I just want to quickly introduce myself. I am from Virginia, born and raised. Did my schooling down there and came up to Philadelphia at the University of Pennsylvania for my surgical training. Loved the area so much that I decided to stay, and now I'm in private practice with Mid-Atlantic Urology. I'm specifically in our media pod in Media, Pennsylvania. I do all sorts of general urology management and procedures, but really am kind of one of my niche areas is vasectomy. So that's what I'm looking forward to discussing today. All right. So what is a vasectomy? Well, a vasectomy is a form of male contraception. Just briefly, it is most commonly an in-office procedure and generally takes less than 30 minutes. One of the most important things that I start out by discussing with my patients, first thing I bring up is that a vasectomy is considered permanent sterility. So really need to be on board with you, your partner, that you are done having babies or don't have any plans to have children at all, wherever you are in life. There's an Office episode where the main character gets a vasectomy, gets it reversed, gets another vasectomy, gets it reversed. Unfortunately, that's not real life. So we really want you going into this with the commitment that this is a permanent decision and there will be no more fertility in your life. As it mentions, typically an in-office procedure. There are some instances where I will do it in the operating room. Sometimes that's a decision that the patient makes. His preference is to be asleep and to not really be aware of what's going on during the procedure, in which case we can do just some light sedation in like a twilight anesthesia in an operating room. There's also some instances where there's some difficulty palpating the vas deferens, and I'll suggest to the man that it may be easier for he and I if he gets a little bit of anesthesia just to make things more comfortable for him. But I would say 9 times out of 10 in the office, and it's very, very well tolerated. Men do great. We get you through it. We do a little talkesthesia, as I call it, to really distract you and keep your mind off things and go through the procedure. I always say it takes about 30 minutes with the expectation it's going to take a little bit less time than that, but I would say 30 minutes, good sort of estimate on total time. All right. Quick anatomy lesson. So let's talk about how sperm, ejaculate fluid, emission of seminal fluid happens. So sperm are actually produced in the testicle. They go through this testicle epididymis and then into the vas deferens. You have a vas deferens and a testicle on both sides. So we do the procedure twice, have to do it on both sides to accomplish sterility. But sort of during the whole sexual act, during ejaculation, the sperm travels from the testicle into this vas deferens, this pipe that picks up some fluid from other places along the way, the seminal fluids and the prostate glands, and then is emitted during an ejaculate. So what are we doing in a vasectomy? Well, very simply, we are just cutting or transecting or breaking the pipe, the tube that carries that sperm into the ejaculate fluid. I often get the question, well, what happens to the sperm? Is it still being produced? Where is it going? If we're just breaking the tube, what's happening? Well, your body is still going to produce, or your testicle, I should say, is still going to produce sperm, but it just sort of dies, gets reabsorbed, eaten up by the body and doesn't become a problem, doesn't affect you in any negative way. And with that cutting or transecting of the tube, I've now prevented that sperm from traveling into your ejaculate fluid and potentially leading to a pregnancy. So other really, really important things to discuss, and these are questions you should talk or ask your urologist. I think men are kind of embarrassed or shy away from some of these, but they're really valid, important points, and I think your urologist should be able to address them pretty clearly, because we know that a vasectomy is not going to affect your sexual experience. It is not going to affect your sensation. It is not going to affect your erections, your ability to have sex, your ability to orgasm. I commonly get asked, is this going to affect my testosterone levels? No. Absolutely not. I am not affecting testosterone levels when I perform a vasectomy. And so it shouldn't lead to any of the side effects of a low testosterone, like differences in your sex drive, brain fog, some of those other potential side effects. A vasectomy also doesn't significantly change your semen. As I mentioned, seminal fluid or semen consists of several components. The sperm from the testicles, but also a large amount of fluid from the seminal vesicles and the prostate. You're still going to have that fluid that's emitted during an orgasm. It's just not going to contain those sperm because we've cut the tube that allows them to transport. So you're still going to have the fluid. You're still going to have an emission with orgasm. Frankly, it's going to look the same, feel the same, all of those things. So your partner is really not going, you or your partner are not going to notice any significant difference in seminal quality. Again, just to say, this is not going to affect your male hormones, your testosterone specifically. So we're not going to have any changes in your voice, no decrease or increase in body hair, none of those sort of symptoms that people associate with low testosterone levels. It's also not going to cause any health problems. Again, this is a simple procedure where I am just breaking a tube that is sole job is to transport sperm. So there's really no long-term side effects to all of this. It does not protect you against STDs, important to know. You still need to use contraception if there is a concern for any sort of sexual transmitted infection. So very, very important point to make there as well. I love this point that it is not going to solve your sexual or marital problems. So certainly, I don't expect that we are going to make or break any good relationships just with the vasectomy. I think it's incredibly important that men communicate with their partners if they have one or one is involved in their sort of child rearing, because it's an important topic that everybody should be on board with. And again, we talked about the finality of it, and so important that everybody knows that and is on board. So I always encourage, I love when I see a partner come into a vasectomy consult with a man, but I always bring up or always mention that, it's an important discussion if one has a partner to have with them. All right, so you're all set for your vasectomy, you're all in, you're looking forward to it. What are some things to expect? This slide mentions stopping aspirin or NSAIDs, which are things like Motrin, ibuprofen, 10 days prior. That's really a practitioner-dependent recommendation. A lot of us say, I don't care, take your aspirin, take your ibuprofen, take an Excedrin the night before, isn't gonna affect me. I'm in that school. I don't care if you continue aspirin or NSAIDs, but it's something to discuss or to mention to your provider. The one thing that is important is that if you're taking any blood thinners, anticoagulants like Plavix, Coumadin, Eliquis, Xarelto, we do need to know about that because those have a higher risk of bleeding complications. And so we'll almost certainly ask you to suspend those for just a couple of days before and after your procedure. I always tell guys, good idea to manscape before the procedure, just so you don't have one of us or one of my nurses coming at you with a clipper. Just an easy sort of trim down there makes it a lot easier for me during the procedure. Nothing fancy, just making sure that everything's kind of tidy is helpful. Washing scrotum with antibacterial soap. So most men will shower the morning of their vasectomy. Just, make sure everything's fresh and clean down there. And again, I'm going to ask that you don't shower for a full 24 hours afterwards. So kind of nice just to get that shower in the morning of your vasectomy for a couple of different reasons. Usually okay to drive yourself. So I tell men they can certainly drive themselves home from their vasectomy. The only exception I make to that is if a man takes a medicine like Xanax or another kind of anti-anxiety medicine before the procedure, in which case I tell you that you need to have a ride home. And that can't be an Uber. It has to be someone who's going to actually make sure that you get home, whether it's a wife, partner, mom, father-in-law, whomever. But in general, if you don't take a medicine like a Xanax before, you definitely can drive yourself. And I have a large percentage of men who do that. Okay, so you're coming in, it's the morning of your vasectomy. What are we gonna have you do? Well, we're gonna have you undress from the waist down. So yep, everything's gotta come off, pants, underwear, all of that. We're gonna have you lie just on your back on an exam table. And what'll happen next is one of my staff members comes in and uses kind of like a antiseptic soap or typically a betadine to clean the scrotum and the area where we're going to be working. Once everything is prepped by the staff, that's when I come in, and the next step, the first step, is applying a local anesthetic. That's with a shot, an injection of a medication like lidocaine. So if you've ever had a tooth pulled, you know that pinch and a burn that really instantaneously numbs the area where it's injected or instilled. This is now mentioning the optional sedation available, and that's typically, in my practice, with a medication like Xanax, a benzodiazepine or an anti-anxiolytic, basically an anti-anxiety medicine, which kind of relaxes you, takes the edge off. I always caution men, you're still going to feel things. This isn't going to take your pain away during the procedure necessarily, or discomfort that you're feeling, but it kind of just relaxes you and makes it a little less anxiety provoking as you go through it. All right, getting into the procedure itself. My personal practice is to do 2 incisions, one on each side of the scrotum. That was the way I was trained. And from my mentors, the thought process behind 2 incisions was really to ensure that you were grabbing the right vas and the left vas to complete a bilateral procedure. There was always the concern that if you just had one incision, would you be grabbing one side twice? That's just a personal preference. That's provider dependent. But I can speak for myself and say that I do prefer 2 incisions, one on each side of the scrotum. And let me tell you, those incisions are tiny, tiny, tiny. When I see men back at a month, I can't even find where the incisions were. So this heals incredibly well. There's no cosmetic differences if you have 1 versus 2 incisions. So the numbing medicine, then the small incision, on one side of the scrotum to start the procedure on that side. What I do is then use that incision, that little opening, to grab the vas deferens and pull it up through the incision. I always tell men, this is where you may feel it. That pulling or tugging on the cord may give you that kind of discomfort in your belly that you feel when you get, hit in the scrotum or hit in the testicles. But I have to pull up on it because then I do several steps to complete the procedure. First thing I do is cut and remove a segment of the vas deferens. So in that previous picture, you saw the tube getting cut. Well, it gets cut and a piece gets removed. So now there's this kind of hole or defect in the area, and I've got both ends that I want to now do several steps to. The first thing I do is cauterize or burn the edges. kind of close them off that way. The next thing I do is use ties to ligate the tubes. Some practitioners will use clips, that's mentioned here. It's not my practice, but again, some, instead of a tie, a little piece of suture, will use a clip on each end. And then the last step that I do, which is what studies have shown the most important part in this whole vasectomy procedure, is placing the two ends into what we would call a surgeon's separate fascial planes. What that means is I'm just putting them in different kind of layers of the scrotum with a little piece of tissue in between, as another way to prevent those ends from finding each other. I will leave a small stitch in each of the incisions on each side of the scrotum, and that stitch is absorbable. It will usually dissolve or fall out in the first couple of weeks after the procedure. And you're done, and you go home. All right, so what does recovery look like? My personal practice is to perform my vasectomies, my office vasectomies, on Fridays. And that's so that you can relax, lay low, hang out, enjoy a lazy weekend. Really want you just kind of hanging out on the couch for a little while, using things like Tylenol, ibuprofen, Motrin for discomfort, and also ice. Big fan of ice during recovery after these types of procedures. Helps a lot with discomfort, pain, but also swelling, which some men will experience as well. So my discharge paperwork says ice 20 minutes on, 20 minutes off, and you can do that throughout the first, that weekend to, again, try to reduce discomfort that you may be experiencing. Certainly wearing tight underwear, very helpful. So not necessarily just, sort of tighty whities. I have a lot of patients whose wives will actually purchase these special sort of post-scrotal surgery underwear. And what they are is basically tight underwear, and they even have a little pouch for an ice pack to go in them. So that's one option. Or if you've got an old athletic supporter jock strap compression shorts that you use to the gym, those are all helpful, again, for decreasing discomfort and also swelling after the procedure. So as I mentioned, procedure on Friday, you take the weekend off, you're off your feet, be lazy for those few days. After that, my recommendations are really just to avoid heavy lifting, greater than probably 10, 20 pounds, and avoid or decrease your gym time for that first week or so. After that, really just listen to your body, see how you're feeling, and can start easing back into your typical activities, gym regimen after that. And then the other recommendation is also to avoid ejaculation for a week after the vasectomy procedure. Again, just optimizes healing. Okay, this is one of the most important points to make about a vasectomy. So we talked about how it's considered permanent sterility. We talked about all of the steps, the process. Those are all sort of my job, accomplishing a successful vasectomy. But this is something that's now in the hands of the patient or of the gentleman who's having the vasectomy done. So I'll say it loud and clear so everybody in the back can hear me, but you are not sterile immediately after a vasectomy procedure. Okay, really important to recognize that it takes 20 to 30 ejaculations to clear that tubing, that vas deferens pipe of the sperm that was in there prior. So you need to make sure that you continue to use birth control for about 12 weeks after the procedure, at which time you will use a special kit that you're provided with the day of your procedure. And that kit allows you to provide your specimen at home, place it in the cup that they provide, add some of the preservative, put it in the mail, and send it off. And you and I, me as the surgeon and you as the patient, will get a copy of the results. Once we get confirmation from those results that there is no sperm seen in your ejaculate fluid, you are considered sterile and you can proceed without using another form of birth control. But it is incredibly important that you make sure that you submit that specimen 12 weeks after the procedure, and incredibly important that we confirm that that test, that specimen, has no visible viable sperm in it. The American Urologic Association used to recommend or require 2 semen samples to confirm absence of sperm. The guidelines now only suggest or only require us to submit 1. So really makes it easy for you. These kits are great because they allow you to do everything at home. You're not showing up to the office with a cup, and really makes it pretty seamless, pretty easy for you. So I'm a big fan of them. And I will harp over and over again about the importance of continuing birth control until we get that result from the semen analysis. Often get questions from my patients about, well, is insurance going to cover this? How much is this going to cost? What's my out of pocket? I don't know. It is highly dependent on your insurance, your plan, your deductible, whether you've met your deductible. There's a whole lot of variables that, as I'm sitting there in the office with you, don't know. But we have great staff who can help with that. And what I always do is recommend that a man reach out directly to their insurance coverage or their insurance carrier, kind of get that information straight from the horse's mouth as to what they are going to cover and what the out-of-pocket expense would be. But I think less than a handful of times can I count that there was an issue and a man couldn't proceed with vasectomy because of some sort of payment issue. So in general, it is it is seamless, and we can make it happen with your insurance company. Okay, some of our last slides here. So emphasizing thinking it through. As I stated, my first statement to men is that this is considered permanent. And so if you have a partner, if you don't, if there's important people in your life that you want to discuss this with, I highly, highly encourage you to do that, because it's a big decision, and we don't want any regrets. I would say a majority, if not all, men who I meet in the office about a vasectomy have done significant research and have a good sense of what they're getting into, and have had discussions for months to years with their partners about proceeding with this. So I think men are, on the same page here, and I think that now in our internet age, I've had guys tell me they learned about vasectomy procedure from a TikTok video. I'm always happy to hear when men say that Dr. Google agrees with what I've just told them. Great to know that. So yeah, just be mindful that this is considered permanent, and so we want everybody to understand that that's a big decision to be making. It says down here, almost all vasectomies can be reversed, but this doesn't guarantee success in conceiving a child. So yes, vasectomy reversals do exist. Okay, when I say this is permanent, there's a little bit of fudging with that. But vasectomy reversals is a long process, not always successful for couples, and many couples are just not even good candidates for it in the future. So I don't want anybody to hang their hat on the idea that, I'll just get it reversed, whether that's in a year or in 10 years or 20 years, because it's just not exactly an easy process all of the time for a lot of couples. All right. That's all I've got. I'd be delighted to take any questions, clarify any points that maybe were a little fuzzy. I am happy to meet with any men to talk about this. Some people want to come in once or twice for a consultation. I have men who come in several times over several years. They just, can't commit or don't want to make that decision, or it takes a little bit of extra time for them and their partner. So I highly encourage, come in, let's talk. Bring your partner. It's always helpful to have another set of ears in there so that everybody knows what's going on and everybody's prepared for the procedure.
Thank you again for joining us. I hope you've learned something today. We appreciate that you've placed your trust in us. If you have any concerns or would like to make an appointment, you can call us at Keystone Urology at any time.